You're listening to the Health and Happiness Podcast with Travis Kemper and
Lauryn Maxwell. Each episode, we share easy to implement strategies to improve your health, happiness, and overall quality of life.
Hey, Lauryn, how's it going?
It's going good, Travis. How are you? What's been new since the last time I talked to you?
Well, it's been 2 weeks because, I got sick last week and lost my voice and had a nasty cough. Since then, I sprained my ankle that day, 2 weeks ago, the day after we talked.
What a fun time.
Oh yeah, it's been a blast. So I rehabbed that, and we'll have an episode on that because I rehabbed my ankle a lot different than I rehab most of my patients' injuries. Because I don't like sitting around and just waiting for things to heal. Let's see. I organized my office mostly and got those blackboards. Those are my vision boards. You surprisingly can't see anything that's written on them, which I guess makes all my goals very private for now.
It looks nice though.
Yeah, I ordered a new health coaching class so I can get a new certification in that. And my book came in on Monday. Let's see what else. I built Buddy, my cat, a new gym. So he's been having fun. It's 7 foot tall in my living room. Yes, it's awesome. And I got to train a guy in the gym the other day. He wanted to learn how to lift weights better and came up to me when I was lifting. And we trained, and I got him squatting free weights heavier than he was squatting on the Smith machine. He was using that because he didn't know how to free weight squat, and I taught him to free weight squat, and he got so excited because
that's cool.
And one day I increased his reps. I told him we're gonna work out some together because it went well, and he works out hard, and I would love a workout partner, as we talked about last time.
That's right. You're starting to recruit somebody, huh?
Yeah, I struggle to find one. So when I had the opportunity to train him, and I've seen him around the gym, and I was like, hey man, you want to keep working on this with me? I mean, we're at very different levels, but it's easy to add weight and subtract weight in between sets. How about you? What's been new in your life?
Well, it doesn't seem like my life was quite as eventful. I didn't get sick or sprain my ankle. I've been actually starting to add little bits of like joy into my life. That's been my goal the last couple of weeks. It's kind of a new goal. Just focusing on adding more time, like focusing on me, even though like that's what working out is, but like you can always add more. So I've been dancing after work every single day. And again, like in my room. But I found, I found this like dance workout that she's like, it's a trainer who is a dancer, and she's on the show So You Think You Can Dance, and I've like followed her forever. But she started her own like little program where she does basically dancing exercises to music, and it's super fun. Dancing's been like a big passion of mine since I was really young. I used to dance a lot. So that's been super fun, and it's a nice way to like end my day. I've really enjoyed it. And then I started doing continuing education. So I'm taking a conference, and it's virtual, so it's like all month long, which is amazing, but it's a physical therapy pediatric conference. So learning a little bit more about my own craft and my own work that I do. I just think it's super fun. I've attended this conference a couple of times, but every year it's amazing the information that you can get.
Awesome. Julia just started dancing too. She bought a video game. So it uses her phone, which she uses the old one in case she loses it. So you hold the phone in your right hand, and then you have to match where they are. I've done that
before. Those games are super fun.
Yeah, I think it's called Just Dance.
Dance, yep.
Yeah, she's enjoying that. Julia is my wife, for those of you who are not aware. Cool. Well, what are we talking about this week?
So this week we're talking about how much you need to work out to improve your health and how to start. And this is a big topic. Overall, like what is health is a big topic. And so we just kind of wanted to put like a little disclaimer at the beginning of this that health doesn't occur in a vacuum. And the ACSM defines health and wellness as it relates in 6 different aspects. And that's not only physical, but emotional, social, intellectual, spiritual, and occupational. And our podcast is going to go into all of these areas kind of as we keep going. But since it's such a big topic, we're going to mostly focus on physical health today.
Yeah. You can improve your life in any of these areas, basically doing the same things, just doing exercises and strategies to improve each one of these areas. However, we cannot talk about that all in one podcast. You folks would be here for days, and we would probably quit doing this. Yeah. Sometime I need to go to use the restroom and, go back to the gym tomorrow morning.
Sleep, maybe. Yeah.
Yeah, sleep's good too. I forgot about that one. So when we're talking physical health, that's kind of the easiest one to see, obviously. Most of my patients that, need more emotional health, social health, they don't see their problem. The self-awareness isn't there. But most people that look in a mirror can say, hey, I'm less muscular, or I'm way overweight compared to what I used to be or compared to what I want. So physical health is definitely an easy one to see. Just some basics. Our obesity rate continues to increase. Here in America, we are up to 42% of the population is obese, according to the BMI, and it has increased 26% since 2008. Increased obesity rates are actually the number one cause in America for health costs at this point. And it's not even close anymore. So, Lauryn, I'll let you go over this Harvard study a little bit and what they found with mortality.
Yeah, so the Harvard study we looked at was talking about how much you increase mortality with a higher BMI. And so if you're a BMI of 25 to 27.5, that is a 7% increase in mortality. If you are between 27.5 to 30 BMI, you're at a 20% increase in mortality, which is a huge jump already. If you're over 30, that's considered obese by the BMI standards, and that is a 44% increase in mortality, which is a lot. It's a lot.
Yeah. And when you said the BMI standards, what are you talking about? Do you have a problem?
I have a little bit of an issue with BMI. BMI is not my favorite way to measure
health.
Health. Because so I am overweight according to my BMI, and as I was telling Travis prior to recording this episode, it is on my medical record as a risk factor that I am overweight. But BMI doesn't take into consideration any kind of body composition. And that's super frustrating.
Well, if it makes you feel better, I'm overweight as well. And once upon a time, when I was in even better shape than I am now, a physician at a physical told me, walks in the room and he's looking at the chart. You know how they do. And he tells me, oh, well, you're a little overweight. And I told him to take his shirt off, and I'll take mine off, and we'll see who's overweight. I was a little arrogant back then, but I still think it holds true today. If your definition of overweight is just based on the BMI, it's not necessarily a good measurement. However,
right.
If you are over 30 BMI, unless you look like The Rock, you probably aren't the most muscular person in the world. One of the problems with the BMI is obviously if you have any muscle. I'm 5'9", I'm 175 pounds. I am the definition of average size for a male in this country. And I'm overweight, and it's not because I'm fat. If you have any muscle, which I'm not a big guy, I'm 5'9", 175 pounds, but if you have any muscle, you're pretty much going to end up in the overweight category.
Yeah. Which, again, why I don't love BMI. So everybody just kind of take that into consideration when you're looking at it. But
I don't either. I think a body fat index, we could make a BFI, would be
I love that. I love that.
That would be a much better true measure. However, these do apply to life, and these do stay kind of true.
Yeah.
Yeah, like we said, most people are not in the situation where you just have an abundance of muscle for
it's
your
a good
size.
down and dirty measure of health.
And it stays true in the increased mortality rates. And for those of you that don't know, your insurance rates can go up because of your BMI. Not necessarily at your company insurance, although I think their insurance rates go up based on the BMI of the company. I think. Don't quote me on that. The insurance can get very, very particular, and they can give you discounts if your employees do things. And a lot of companies, insurance programs do this, and they pass on the discount to you. So, if you even something as simple as my mom used to work for a hospital system in Pennsylvania, and they gave everybody that wanted one, they gave them a Fitbit.
Yeah.
But they had to submit their steps and stuff like that.
Right.
They had to submit their data on that Fitbit. And if they were over a certain amount of activity, they actually got a discount on their insurance. I think that happened to my mom's. I know they got the Fitbit for free because it was just an easy thing to progress. But I actually did an internship in insurance, and I know that they do that stuff. So the goal of this podcast would be to tell you, what do you need to do? And some of this I agree with, some of it I disagree with. Any activity is better than no activity, flat out. And then we're going to talk about how to start. So, Lauryn, I know you've looked at the Acsm recommendations. Acsm is one of the governing bodies for health and fitness, basically. What do they have to say?
So in their book, they said that Americans can substantially improve their health and quality of life by including moderate amounts of physical activity in their daily lives. And again, they wrote in their book as well, some physical activity is better than none, because the greatest health risk is to be totally sedentary. So as long as you're getting up and moving, that is a hugely important start to reducing that risk and getting some of the benefits of moving your body and getting movement into your day.
Yeah, I know a lot of things recently in the past 10 years, they've been saying being sedentary, sitting on the couch, laying in bed is actually worse for you than smoking. So if you're going to do one of two things, you should smoke over sitting on your butt all day.
We're not endorsing smoking.
No, I wouldn't suggest it. But if you had to choose one or the other, smoking, as bad as it is for you, is better for you than sitting on the couch all day.
That is crazy. That is crazy. Ugh. And so the Acsm also found that some health benefits have been identified with as little as 60 minutes a week, which it makes sense, but I didn't know that before I was looking it up, and it kind of surprised me, which I guess kind of answers the very nitty-gritty part of the question of how much working out do you need to do to improve health. If you can start there, start there. If you're going for being totally sedentary and not getting off your couch, start 60 minutes a week, but a target of 150 minutes a week of moderate intensity exercise provides significant health benefits. So 150 minutes a week, you could split that up in multiple ways, but the easiest way to split that up is 5 days a week for 30 minutes of moderate intensity. And the Acsm defines moderate intensity as a brisk walk. So that's totally doable by the majority of people.
Yeah, a brisk walk. And how do they define? Did they define a brisk walk?
Not that I saw.
Okay, so I've seen their definition of a brisk walk. A brisk walk is basically you walk slightly faster
than your normal pace.
Than your normal pace, yes.
Which is basically what I do to try to keep up with everybody else, because I walk very slow.
Because you have really short legs.
Very short legs. I'm very disproportionate.
Yes, so they say healthy adults should participate in moderate intensity aerobic physical activity for a minimum of 30 minutes, 5 days per week. And like you said, moderate exercise is brisk walking. This is not a stretch for most people to be able to do that.
That's the nice thing, I think, is the ACSM really like breaks it down to where like you can do it. It doesn't take like, you don't have to be in the gym going crazy every day. And I mean, it did say, of course, that there's more benefits to people who are doing more, but to start seeing the benefits of getting more activity, you don't have to start crazy.
Well, and I'll go even a step further. I mean, they're talking about moderate exercise. Anything is better than nothing, like they said. A lot of times people will ask me, like, how long do you work out a day? And I'm like, literally 30 to 45 minutes.
Right. Yeah.
Like, I mean, unless I go for a hike, which I have been doing a lot lately, mostly because my dog needs a minimum of 3 miles, or I can't take it.
Yeah,
I feel like I'm going to kill him. So I've been doing a lot of hiking because I live in a place where I can literally walk out my front door and go for a hike. And I also love it. It's just nice to get out in nature. Yeah, it's so great. So we've been doing a lot of that, and we usually do a lot, but I've been making more of an effort just because of the dog. But when I go to the gym, it's 30 to 45 minutes. Right. 45 is a maximum. And that's really on a weekend when I'm feeling kind of like we talked about in the last episode, where I'm tight and my body feels all wound up and I just don't feel good. And then it takes like 15 minutes to get into it. Mm-hmm. And then I can hit it hard. But I would say mine is more of a maximum level of intensity. In every exercise, I'm pretty much gasping for breath. Right. And I lift weights mostly. So it's just I like to incorporate my cardio and my strength training at the same time. And the reason I do that is simply for time management. Like, totally. I could spend 3 hours a day in the gym. I used to do that. However, I now have a wife and, a dog and a full-time job, right, and a business on the side. So it's like, this is what I allot to myself. For myself.
Yeah. And I think that that's such an important thing to distinguish for people who are just getting started, because feedback I hear all the time is it's really intimidating to see people who are in the gym for 3 hours or whatever a day, I don't have time for that. I have a husband, I have a dog, I have a full-time job. We're doing a podcast. Like, I also want to learn to dance, all this stuff. Like, I have other things I want to do. But it doesn't have to take that. You don't have to spend 3 hours in the gym. I also am usually like between 30 and 45 minutes of training a day. At the very most I've ever done just an hour.
Right. And I can legitimately make myself vomit in 15 minutes if I want to.
Oh, that's gross.
I mean, it's just like you can push yourself so hard in a 7-minute Tabata workout will absolutely tear you out.
Oh, absolutely.
So yeah, there's a lot of ways to get it done in a very short period of time. And one thing on those people taking 3 hours in the gym, I would say go watch them.
Yeah, good point.
Because they're not doing shit.
Right. Yeah.
They're mostly talking and they're walking around. There's nobody.
Taking some selfies.
Right. There's nobody that's not a professional athlete that actually works out for 3 hours a day. Right. Yeah, they're taking selfies, right? Which is,
See them all the time.
Right. Yeah. I still haven't ever taken a selfie in the gym. I really need to up my selfie game.
I do sweaty selfies, but like I said in the last episode, that's part of my accountability is I exchange, and that's after the workout, not during. I don't touch my phone during the workout. I don't take a whole lot of breaks. Like, that's why it's efficient.
Yes. Efficiency is key. I really need to up my selfie game. I think I've taken 4 in my life.
No, that's something you should, make a goal. You don't need to take selfies.
It's probably not going to end up on the blackboard.
Okay.
So how do you start?
I think go back and listen to our last episode on goal setting, because I would say the first step is to identify your goals and, what is that driving force and what is that deeper why? And then how can you break that deep why down into distinguishable, small short-term goals that you could work on every single day, right? And then I would say the next most important thing is to, before you're starting, identify your barriers. And again, this is a lot of what we talked about in our last episode, but identifying what has stopped you before or why you feel like you can't start, and that could be, I hate going to the gym. I was one of those people. It could be, I don't have time, which, Travis, what do you have to say about people who don't have time?
Look at where you spend your time. Track your time spent for a day. I always can find time to do whatever I want. Now, if you ask me to do something and I don't want to do it that bad, I will flat out say, yeah, I'm not going to make time for that. I try not to say I don't have time for anything. So I've tried to take that out of my vocabulary because I can always find the time. It's just, I would rather spend that time with my dog maybe than or with my wife, or working on this business, than going and doing whatever you're asking me about.
Right. So, and boundaries are important. Like, we're not saying say yes to everything. That's not what we're saying. But if it means something to you, if you want to start working on your health, you can find time. I mean, Travis and I
don't have time as a cop-out.
Yes. Travis and I were talking before starting this episode, and at least my iPhone tells me every week how many hours I spend on my phone. I'm like, it's a lot. It's a lot. I have like 5 hours of time that I spend. And I think the average, Travis, that you said is 5.4 hours on the phone that the average person spends scrolling on social media and stuff like that. Right. And even me, like, I have 5 hours of time that racks up on my phone, or a little bit less every week.
A day or a week?
Oh, sorry, a week. I mean, a day. Yeah. Oh my gosh.
Wait, you're doing 5 hours a day on your phone?
Well, I work on my phone.
Oh, okay. Well, there, I'll give you a little bit of an excuse then. But the average person spends 5 hours a day on their phone and 4 hours a day watching TV. I don't know how you do those. My assumption is you have to be multitasking to do that. That's 9.4 hours.
That's a lot of time. Yeah.
So you got to be multitasking is my guess. Yeah. And then another thing.
Take that factor and say, okay, well, if I'm spending 5 hours on my phone a day, take 45 minutes out of that 5 hours and start there.
Yeah, I can probably get you an easy hour a day.
Yeah.
Right away.
Yeah.
Just delete Facebook, delete Instagram, delete Twitter, delete, what else do we have? OnStar? I don't know. What TikTok. I don't have any of that stuff on my phone. Delete it all. If you take it all off, you will probably be a happier person right away.
Well, yeah, and I think your phone at that point, like, what is your phone for?
Well, I mean, I still figured out how to use mine. I don't
even know what I would do if I didn't have social media on my phone.
I still use my phone. However, I do not use social media. I also, one other thing that I would recommend is my first hour of the day, my phone's not on. And this is a hard one.
You're telling me that.
Yeah, this is a tough one. So I charge my phone in my office, and I won't go into my office for the first hour of the day. Now, sometimes it's different. Like today I woke up and I was like, did it snow in Vail? Because if it snowed in Vail, I need to change my reservations. And if it didn't snow, I need to not change my reservations so I can go skiing today. It didn't snow, by the way, so I did not go skiing. It's very sad. We're having a terrible year for snow.
Oh.
Yeah, I think you guys are doing a little better out. A little further west and north is doing much better. And the East Coast is doing great, but their snow sucks anyway. So I don't want to ski there. Anyway.
So do you have an actual alarm clock that wakes you up and not your phone?
Watch.
See, I
use a watch.
That's part of that, because my alarm clock is my phone. Actually, I just ordered an alarm. You guys, I just ordered an alarm clock. Like, I feel like kind of an adult. I'm super excited about it. Like, I've never been so excited about an alarm clock. It is one of those sunrise alarm clocks.
We have one.
I'm so excited. So I can get rid of the phone. My phone, I put like a a lock on it so that I can't access it between the hours of like 7 p.m. and 5 a.m. And I'm up before 5 a.m. So that is technically part of the first hour of me being awake, but it's my alarm. So I like have to look at it immediately. But now I'm trying to get rid of that. So this is an example of working through barriers. Like this might be, I mean, it's not a barrier for you. Clearly you've been successful with it, but like breaking down things like this where you can even just improve your efficiency in the morning, or like make getting to the gym even easier. Or for me, my gym is right behind me. But like I said last time, putting slippers by my bed, just making it that much easier, like defining your barriers and figuring out how to work around them, you know. And one of the barriers that I hear a lot is I can't stay consistent. And then, so what do you do about that? How can you stay consistent?
Go back to your goals.
Go back to your goals.
Go back to your goals.
Accountability partner.
Yeah. Work the plan, get an accountability partner. Go back to episode 1 again. Work the plan. Know your why. Why are you doing this? You're doing this. Maybe you're doing it for your family. Maybe you're doing it for yourself. Either one of those is fine. Maybe you're doing it for your patients. One of the reasons I get up and I work out every morning is because I know I'm a much better physical therapist to my patients after I've worked out. My mind is clear. I'm bonkers first thing in the morning if I don't work out. I'm here, I'm there. I can't control my brain. So I have to work out. I have to meditate. I have to journal. I do all this stuff because I need to take that time for myself so that I can be the best person I can be for others.
Yeah. And I would agree with that. I mean, I feel like, and you don't have to just have one why. And I have multiple too. I mean, one of them I talked about last time, which was loving myself better, but also being a better physical therapist. I am a pediatric physical therapist, so I'm constantly like crawling around on the floor, getting in all these weird positions. Like that is just the nature of a pediatric physical therapist. And if I'm not working out, I can't do that. Like if I'm not working on my strength and my flexibility every day, I can't keep up with these kids. They're a lot. And then my third why is when I have my own kids, I want them to see this habit and this thing that I've cultivated for myself, and that it's important. And I don't want them to have to, because I struggled in my adult life trying to fit it in because I never really saw it modeled for me. And I never really saw my parents, like, you know, making time for that every day. And so it was really tough as an adult trying to put that back in my life and find joy in it and make it, you know, something that I really like to do. But I want my kids to see that as a foundation and grow up with it.
Yeah, that's a good reason. That's a good reason for any physical therapist to do it too, because, you know, you want to be a model for your patients. The easiest thing to do, I would say, is to start small. Start small and just do it. Stop making excuses, just do it. You know, it doesn't matter what you do. You can do yoga, you can do push-ups, you can do pull-ups, whatever it is that you want to do. If you want to go for a walk, you want to go for a run, a hike, whatever it is, whatever makes you happy, do that.
Whatever makes you happy, do that. Can that be the headline of something? Travis, you have such great one-liners. Like every episode, I'm going to pull it out. That's it.
That's because I use this all the time on my clients and patients. I've refined these over the years. So yeah, stop making excuses. Stop justifying not doing it, and then continuing to be unhappy with your body, with your looks, with your health. Just do it and start small. I don't care. Most of my patients, I'll tell you, I do 2 exercises. 2. Do you want to take a guess? Most of my patients are elderly.
Squats.
Sit to stands.
Yeah.
Stand up and sit down out of a chair and go for a walk, usually with your walker. That's what I start my patients on that are elderly. And they look at me like I'm crazy. And I look at them like, I know you're going to do these 2 things. You know why? Because there's no great excuse not to stand up and sit down for 30 seconds a day, twice a day, and to go for a walk that is not going to the bathroom, the kitchen, or whatever. It's just getting up and going for a walk. And almost every time, if they do that, they are amazed. Within 2 weeks, their life has changed. It's crazy how fast it actually happens, and how fast you can improve it. But Again, I would start small. And when you're making goals for any of this stuff, I would go with one goal at a time. Mm-hmm. So I would make one goal today. Maybe you say, okay, I'm going to take Travis's stupid chair exercise. This is so dumb. This is not going to work. I'm going to take his stupid chair exercise and I'm going to do that. And I'm going to get up and down as fast as I can for 30 seconds. And then I'm going to walk outside. And you're going to do that. And then I guarantee you're going to see benefits. Yeah. And then the next week, or after you've got this down, like you've got your routine down for your exercising, the next week, start another goal. And maybe you make a diet goal. And maybe your diet goal is as simple as I'm going to replace one meal with a salad. Instead of eating French fries and a sandwich every day at lunch, I'm going to eat a salad.
Yeah, I think that's such a great piece of advice, because a lot of, sticking to something is being able to keep a promise with yourself. That's what it is, right? And if you're breaking that promise to yourself, you're losing trust in yourself. And that's why I think it's hard for people to come back from it. But if you can pick one thing, something small, and keep that promise to yourself, gosh, you build so much more trust with yourself. And then you realize you're capable.
We're all alike. So we're all just trying to get better.
We're all just trying to do our best.
Right. We're all climbing a mountain. We're just all at a different spot on each mountain.
Absolutely.
Anything else you want to add, Lauryn, before we call it an episode?
I think we said most of the things we wanted to say. Just do it. That's what I want to end on. And if it makes you happy, do it. Or something like that. Gosh, whatever you said, that was way better.
We'll make sure to cut that one out. That was fun. Again, this is how I'm going to end every episode. That was fun.
That was fun. Yeah.
Bye, everybody.
Bye.
Yeah. Thank you for taking the time out of your busy day to listen to this episode of the Health and Happiness Podcast. We hope you enjoyed the episode and are getting benefits from our content.
If your life is improving in part due to the information in this podcast, we would greatly appreciate you sharing the episode with your family and friends on social media and leaving us a review so we can continue to reach more people and improve the health and happiness of the community at large.
Thanks again, and we will see you next week for another episode of the Health and Happiness Podcast.